Well, hello, everyone. Thank you so much for joining us today. It looks like from the chat, we have folks from far and wide. And so I'm thrilled to be here with Alexis Guild and with you all today. And we're going to be talking about policies and strategies to care for ill or injured H-2A workers in the US and at home. So if we can go to the next slide, please. I'm just going to quickly go over our agenda. We wanted to do some introductions, and hopefully you got a good feel for Alexis and myself from Sylvia. We're going to talk about H-2A worker rights and their access to healthcare, looking at some of the work-related concerns in agriculture. Hopefully by the end of this, we'll all have a good feel for what we mean by workers' compensation and what the role of the healthcare provider is in providing workers' compensation and other care for our injured worker. Looking at the role of the community health worker. And then both Alexis and I will share resources from MCN as well as FJ, Farmworker Justice. So with that overview, I'm going to just tell you a little bit about MCN. Our next slide. MCN's mission is to create practical solutions at the intersection of vulnerability, migration, and health. And we've been around since 1984, and we have really worked to help community health workers, doctors, nurses, nurse practitioners, nurse midwives, physician's aide, physician assistants, social workers, anyone who's caring for immigrant and migrant workers and their family. We have worked hard to provide them with training, support, and resources so that they can provide the best care to the farm worker population or the immigrant population that they're caring for. And with that, I'll turn it over to Alexis to introduce Farmworker Justice and a little bit of background of our H-2A workers.
Thank you, Amy, and thank you everyone for being here, and National Center for Farmworker Health for hosting this two-part webinar series. I am thrilled to be here with Amy. We work very closely together. Farmworker Justice works very closely with Migrant Clinicians Network, as well as with National Center for Farmworker Health. So I'm really excited to be here and share all this information with you today. And also, we both really encourage you to please type in any questions you may have, any comments you may have, any stories that you may have working with H-2A workers. We will be talking about H-2A workers specifically during this webinar. But, a lot of what we talk about, especially when it comes to healthcare access, workers' compensation, does apply to the greater farm worker community as well. As Amy mentioned, and Sylvia also mentioned, my name is Alexis Guild, and I am with Farmworker Justice. For those of you who may not be familiar with our organization, we are a national organization. Our mission is to empower farm workers and their families to improve their living and working conditions, immigration status, occupational safety, health, and access to justice. We have been around since 1981, and we are based in Washington, D.C., but we really use a multifaceted approach. So, of course, we engage in policy advocacy, but then we also engage in litigation, public education, and capacity building. Next slide, please. And a lot of our work does center around the H-2A program, although, and we do a lot of advocacy around the H-2A program, really ensuring that H-2A workers have strong protections while they're in the United States. However, of course, we also work with all farm workers across the United States. But today I'll be talking specifically about H-2A workers. So for those of you, I'm sure all of you know H-2A workers, have worked with H-2A workers. For those of you who may be less familiar with the program, it is a non-immigrant visa. Employers have to apply to the Department of Labor. They basically have to certify that they do not have domestic workers to fill those positions. They go to Department of Labor, they request a certain number of workers to fill those positions. The Department of Labor certifies those positions, and then employers tend to work with recruiters in their home countries. Many are from Mexico, but there are H-2A workers from other countries, including Latin American countries, but also South Africa, Jamaica, and other countries around the world, but the vast majority are from Mexico. And then they come to the US. They are here for up to 10 months, generally. And they do have to return home. Many H-2A workers do return year after year, working for the same employer. There is no cap on this program. So because there is no cap, I'm sure you have seen in your communities that the number of H-2A workers continues to grow. And since 2016, the program has actually more than doubled. So last year, 2022, there were 371,000 workers who were certified to participate in the H-2A program. And it continues to grow year after year, which is why there is so much emphasis and so much discussion about H-2A workers. In 2023, their what's called adverse effect wage rate, or AWR, which is essentially a weighted average of the hourly wage rate of field and livestock workers, and this is a national average, was $16.62. And so that is their hourly wage rate under this adverse effect wage rate. Of course, in your state, that may be higher because of the hourly wage rate in your state. I will say I am doing a very brief overview of H-2A workers, and as Sylvia put into the chat, my colleagues last year did a webinar with National Center for Farmworker Health that talked more in depth about the H-2A program. So I certainly encourage you to go to that webinar to learn more details about the H-2A program and the rights of workers. Next slide, please. So in order for employers to bring H-2A workers into the US, there are certain requirements that they must abide by. These are protections both for H-2A workers as well as domestic workers, so US workers. So employers must provide H-2A workers free housing, which is why H-2A workers tend to be more isolated, because they live in employer-provided housing, which can range from trailers to labor camps to motels, depending on the housing stock in the area. But they do tend to be more isolated and harder to reach because they do live in employer-provided housing, which is sometimes on employer property. Employers must also reimburse the travel costs or cover the travel costs from the home country to the United States. They have to guarantee in their contract at least 3/4 of the contract. So if they if they're here for, if the contract is for 4 months, then they have to guarantee work and wages for at least 3 of those 4 months. They are not allowed to charge recruitment fees. So employers work with recruiters in their home countries to recruit H-2A workers. The recruiters are not supposed to charge fees to these workers. Now we know it happens. but it is not supposed to. It is prohibited under the H-2A program. There is also an anti-retaliation measure. So if workers if the conditions are poor, if they're not, if their rights are not being protected, and they speak up, if they go to legal services, if they report a violation, there is an anti-retaliation clause. Of course, we know in reality that that this is not necessarily followed, and we know that many H-2A workers are often reluctant to report any violations because of that fear of employer retaliation. Workers are also supposed to receive a written contract. They're supposed to receive a certain wage rate, and the wages that H-2A workers receive are to also be provided to the domestic workers who work alongside H-2A workers. And the same is for workers' compensation. And again, this is just a brief overview, and I encourage you, if you want to learn more about the nuts and bolts of the H-2A program, to click on the link that Sylvia provided. Next slide, please. Health insurance is something that is really important for H-2A workers. And I talked more about this in a presentation I gave last year, and Sylvia put that link in the chat. But H-2A workers are eligible for emergency Medicaid. And of course, the eligibility in terms of the conditions that that allow for emergency Medicaid varies by state. But in terms of the immigration status, H-2A workers are eligible for emergency Medicaid. They also are eligible for employer-provided health insurance. They can go to health centers, and they are eligible for the Affordable Care Act health insurance. And the next slide talks more about the Affordable Care Act. And I know that this has been a point of a lot of questions over the years. H-2A workers, ever since the beginning of the Affordable Care Act, have been eligible. Now, there are certain parameters around that. So H-2A workers are only eligible while they're in the United States. So once they leave the United States, they are no longer eligible and they must disenroll. When H-2A workers arrive, they become eligible because they become they have an immigration status. They have the H-2A non-immigrant status upon their arrival in the United States. If they arrive outside of open enrollment, they're eligible for a 60-day special enrollment period. And that special enrollment period begins the day they enter the United States. So they have 60 days. If they arrive outside of open enrollment, they have 60 days from the day they enter the United States to enroll in health insurance. They are eligible for financial assistance. They're eligible for tax credits. They're eligible for cost sharing reductions to lower the cost of premiums, as well as co-pays. And this depends on their income level and their family size. And H-2A workers do file taxes, and they do have to file taxes when they enroll in ACA insurance. And so whatever they put into their ACA application should match what is on their tax form. And of course, they must disenroll before leaving the United States, because once they leave, they're no longer eligible because they don't have that immigration status. There are a lot of challenges around ACA enrollment, and it takes a lot of effort to enroll H-2A workers. And I go into more detail on that in that webinar. So I certainly encourage you to go to the Supporting H-2A Workers Access to Healthcare webinar from last year, for a lot more information about H-2A worker eligibility for the Affordable Care Act and strategies to enroll them in health insurance. And please feel free to type into the chat any questions that you may have or any comments you may have. Next slide. Of course, there are community health centers, and everyone is eligible to receive healthcare at a health center, regardless of their insurance status, regardless of their immigration status. Health centers do not ask about immigration status. And health centers have been doing a lot of work to do outreach to H-2A workers specifically, and to provide healthcare to H-2A workers, especially considering that H-2A workers are harder to reach. They don't have their own transportation, and may not be aware of the resources in their community, including any community-based organizations, health centers, and legal services. Next slide, please. Now, here's a question for all of you. Do farm workers, and I mentioned workers' compensation, so now I'm coming back to it. Do farm workers have access to workers' compensation insurance in all states? And we're going to put up a poll question, and the choices are yes or no. And if you would like to provide in the chat any reason why you are saying yes or no, any commentary, please do so. It looks like it's about half and half right now. Okay, so it looks like 48% said yes and 52% said no. And for anyone who said no, Yuridia says that in California, they can apply for workers' compensation, but in other states, they're not able to. And that is right. If you want to go to the next slide. So farm workers farm workers in general do not necessarily have access to workers' compensation. Coverage varies by state. So as you can see in this map, there are a handful of states, California, Oregon, Washington, Idaho, Arizona, New Mexico, New York, and a few others, where farm workers have the same access and coverage of workers' compensation as other workers. But you can see that in other states, the coverage is either limited or it's completely optional, where employers are not required to provide workers' compensation to farm workers. But H-2A employers are required to provide workers' compensation regardless of the state law. So in Texas, for example, as you can see, employers have optional coverage of workers' compensation of their farm workers. So employers do not necessarily have to cover their farm workers under workers' compensation. However, an employer who has H-2A workers is required to provide workers' compensation to his workers, including H-2A workers, as well as other workers who work alongside those H-2A workers. Workers' compensation is available to all H-2A workers, regardless of the state that they are living in. And with that, next slide, please. We are going to talk more about, now that we've talked a little bit about H-2A workers, we are going to kind of dive deep into the work-related concerns in agriculture, But before we do that, I just want to check and see if there are any questions or comments. And feel free to type in the chat or to raise your hand. Well, I'll continue. Amy, if you want to dive in, I'll continue to monitor the chat while you are presenting. And then if there are any questions, I can either respond to the chat or Amy, I'm sure you're also looking at the chat as well. So you can respond during your presentation.
Great. Thank you so much, Alexis. That was a great overview. And I'm going to get back to that workers' compensation introduction that Alexis gave, but Johanna is already filling out the chat. I would like you just to take a minute to put some of your thoughts in the chat about what are some of the work-related concerns that we have for our farm workers in agriculture. And Johanna put pesticide exposure. Are there other concerns that you all can think of? Let's get you chit-chatting with us a little bit through the chat. Yeah, heat. It's like that is on everybody's mind right now, particularly as our climate crisis worsens and our number of heat days. And I know that we have a lot of folks from the southern US that it's really, really hot right now. Interactions with large animals, absolutely. Slips and falls, exposure to poor air quality, animals, moving quickly here, air quality, back-related injuries, spine injuries, lots of injuries. You guys are wonderful. Lots of knowledge here about the types of work-related concerns that we have in agriculture. Agriculture is a very dangerous occupation. So let's go ahead and just, if you can just click, it'll come up with a list, Sylvia, of kind of condense some of the great responses that we've gotten in the chat. I think if you just press forward, it should pop up on the slide. There you go. Yeah, so you all mentioned many of these in the I don't think I have the eye injuries, but both from the sun and from injuries, PTO, and tractor and other safety risks, and then repetitive movements. All of these are very big issues. So basically, our body and our muscles, our musculoskeletal system, because of the repetitive nature or just some of the actual nature of agriculture work, can cause injuries. Workers are prone to, they work with sharp instruments, they work with large animals, they're are at risk of lots of different injuries and trauma as a result. Vehicles, skid steers and tractors, pesticide and other chemical exposures. So pesticides are a huge concern for our farm worker population. Farm workers are the most overexposed worker population to pesticides, but there are also other chemical exposures, carbon monoxide, and other types of chemicals used in the processing of our food. We mentioned a lot about heat, but many workers also work in the cold. So frostbite and getting being affected by the cold, burns. For those workers that are working in tobacco, there's green tobacco illness. There's bladder infections, skin issues, infectious disease, and transportation related concerns. And some of you are putting in there some really good things about relationship with employers, stress and anxiety, alcohol use and abuse. Those are all important issues as well when we're thinking about our agricultural workers. Next slide, please. So I think what's important to remember is that in addition to the work that farm workers do, and agriculture is very dangerous, And we just listed a number of really important health-related concerns that we have for those that are working in agriculture. But also, there are many issues that our migrant and mobile underserved population face that also the general public faces. And I think the last two comments, the stress and anxiety, alcohol use and abuse, but like chronic illnesses and diabetes, cardiovascular disease, all of those are issues that the general population endures, and also our farm worker population endures. But if you're having a migratory lifestyle, the living conditions, the occupation, the work, they all can make that those particular health issues more, they can make it exasperate it or make them more difficult to address. So I think it's important not only to remember the risks that our agricultural workers face on the job, but also the risks that everyone else has, our diabetes, our cardiovascular disease, that's also going to be accentuated in our farm worker population. Next slide. And then, you know, a lot of times we don't think about the fact that our farm workers are, just like you and I went to work today, our farm workers are working, but also their living quarters are part of their work. Many farm workers live near where they work, but they live in employer provided housing. This is particularly relevant for the H-2A workers. And often there are cases we know that our farm workers live in housing that's not substandard, but in many cases, farm workers are living in substandard housing. And there's some illnesses related to that. Can you click the next forward on that one? So various gastrointestinal illnesses, all kinds of infectious disease like tuberculosis. And I think we all know of another infectious disease, which I'll talk about in a minute, which is COVID-19, parasites, conjunctivitis or pink eye. Someone mentioned lead poisoning because of the type of housing they live in, but that's that is an issue. And then just living in communal housing makes things spread faster. So when we think about the various health challenges, we have the occupation, the actual tasks that the farm worker is doing on their job. We also need to remember that they have other health conditions that are similar to the standing population, but also think about the housing that they live in and what they may be exposed to as a result. And they also might be doubly exposed to pesticides, particularly if they're living close to the fields where they're working, where they might not be working when the crops are being sprayed or when pesticides are being applied, but they might be nearby and they might be exposed from drift. Let's see, Corey's asking, is there a list of agencies by state that provide health services for migrants to enforce H-2A safety standards? And is there an agency that inspects water quality at worker camps to make sure it's safe and potable? If it's okay with you, I think we're going to save that one. Those are great questions. And I think we do have some answers for you, but let's save that to the end of our talk. At the end, we'll come back to that. Next slide, please. So I did want to talk just a little bit about COVID-19 and farm workers. And I think a number of the points that I made in the previous slides about farm workers living in close quarters, making them more susceptible to infectious disease. That was one of the reasons that when COVID first came on the scene, at first it was affecting the very rich, the skiers, the vacationers in Italy, and then they came to different places, and then we began to shut down, except that we had requirements for what we were calling our essential workers. And even though they were essential, we did not treat them like essential workers, but basically farm workers were considered essential workers. So that put all the workers who were essential, the food and farm workers, putting food on our table, more at risk for COVID-19. And because of their closed living quarters, because of the transportation, because of the very nature of their work, they were likely to be more at risk to get sick and to die from COVID-19. And it's a good segue into the discussion about caring for the ill and injured workers, because I think it's really important to make the argument that COVID-19 and farm workers is very much a work-related disease. And that becomes important, and I'll get into this in a minute, when we think about sort of the kind of health care that they might need and any complications that arise. So as we move into this next phase of COVID, where it's no longer an emergency, where we're no longer making certain allowances for workers who, to prevent COVID, for workers who contract COVID, it's really important to make sure that we're underscoring, that we're acknowledging the work-relatedness of COVID-19. And one of the reasons that that's important is, in many cases, and many of us have had COVID, in many cases, we get COVID, we recover, and we're fine. But in about 10% of the cases, people who get COVID-19 suffer from what we're calling long COVID. They have certain symptoms that persist: fatigue, brain fog, some have like a persistent cough, many different symptoms, but that long COVID may prevent them from working. And that becomes really important when we think about what kind of healthcare our farm workers will need and what kind of benefits they have access to. Let's go on to the next slide. So what is workers' compensation, and how does it fit in with this discussion that we just had about the kinds of illnesses and injuries that a worker is at risk for? So really, I think a lot of us think about, oh, workers' compensation is about medical treatment for the injured patient, and it is. If a worker has workers' compensation and they're injured and they need immediate care or long-term care, or they need access to certain specialists because of that illness or injury, workers' compensation should cover that. It's in the form of insurance. It should cover that care. And so for our farm workers who are injured, this becomes a really important form of insurance. And because we're talking about H-2A workers, it's really important that they know, and that you all know, what it is and why it might be relevant to their cases. The other piece is that workers' compensation gives the worker some wages while they are being treated for their injury or illness. I don't think it's not the whole amount, and it varies, but it's usually about 60% of their wages that they're eligible for, so that they're not suffering without payment. And the idea of workers' compensation is to treat the worker, make sure that they're able to survive during the time that they need to recover, but to get them back to work. I mean, that's the ultimate goal of workers' compensation. In some scenarios, workers can go back to work and maybe have different kinds of duties. That's really challenging in agriculture, but there are some cases, some situations where, maybe working in a packing house might be less problematic to the injury that the worker experienced than harvesting from the field. And then the other piece about this is that workers' compensation can be used sort of as this database, right? It could help us really understand what's happening, what kind of injuries workers are experiencing. So it's a type of like monitoring and surveillance system, right? So that we can see what's happening, and ultimately we can use that information and go back and try and prevent the incidents from occurring. I mean, so there's a lot of very important goals for workers' compensation. One, to help the worker get the care that the worker needs, to help the worker get paid while he or she is injured. And I should say, and I somehow it fell off this slide, but should the worker die, the family is eligible for some benefits. So I should say wages and some kind of financial compensation. But really the idea is to get workers back to work and hopefully understand what happened so that those types of problems can be prevented. And so there's like a public health aspect to it. Next slide. So who is eligible for this? I think Alexis went over that all H-2A workers, it doesn't matter what state, and there are lots of challenges about workers' compensation and agricultural workers, but if you're an H-2A worker, it doesn't matter what state you're in, your employer is required to provide you with workers' compensation insurance. All workers who work on that farm, the same farm as an H-2A worker, they are also eligible for workers' compensation. So let's say you're in a state that isn't required to provide farm workers with workers' compensation, and that there's H-2A workers working on a farm, but they also are hiring some workers from the community. They can't just pay for workers' compensation insurance coverage for their H-2A workers. They have to do it for all workers. So I think that's a really important thing to remember, particularly if you think about Alexis's slide with the number of H-2A visa holders increasing. We're going to see more and more H-2A workers, and we're going to see also some of those mixed situations where some workers have an H-2A visa and other workers have other types of documentation, or some don't have documentation at all. And then if it's an agricultural worker and we don't have any H-2A workers on that farm, their access to workers' compensation is going to depend on the state. Next slide. So, and I think there's a really good question from Johanna here about undocumented workers working on a farm with an H-2A workers. Are they eligible for workers' comp? One of the questions we didn't ask you, like, does it matter what your documentation status is? And technically, it does not. And I'm saying technically, and I think that I do want to acknowledge that while I talked about all of the benefits of workers' compensation and the importance of workers' compensation, I think it's really also important to acknowledge that helping a worker through the workers' compensation process can be challenging. And many workers, particular workers with more minor injuries, are going to be less inclined to try to access the workers' compensation. They're more interested in working. They're more interested in being able to come back the following year. They don't want to get blacklisted or, you know, be seen as a worker that is going to be complaining. But if it's a serious injury, or, you know, I think it's really important to be able to have conversations with workers to help them understand that this is a potential benefit that could really help them. So what can the clinician do? So I want to talk a little bit about, and this is thinking about the being community health workers or helping workers, understanding what the clinician can do. I think you can help talk to farm workers and help them understand some things that they can tell their provider. So let's go to the next slide. One of the pieces about work-related injuries is that it becomes crucial to document the chart that it was potentially work-related. So even if a patient comes in and they're a farm worker and they have COVID, documenting the chart that they think that the worker, more likely than not, I'll get into some of the language in a second, this was a work-related exposure, it becomes really important, because at that moment in time, the worker may not be that sick, but what happens if the worker gets long COVID and can't work? Having that chart documented becomes really, really important. So thinking about the farm workers' future needs, thinking about, is this work related? So that list of injuries and illnesses that we talked about at the beginning, like pesticide exposure, musculoskeletal injuries, and green tobacco illness, I think that there's some real obvious connections between, yes, that's certainly caused by the work. But if we go to the next slide, click one more time. So when we go to our nurse practitioner or to our doctor and we say, I think I have the flu or the influenza, or they think you have some kind of respiratory infection, doctors like to be very, very certain. They like to be like 95% certain about like what their patient is, and that they document that in the chart. But what's really interesting about a work-related injury or illness is that they don't need to be 95% certain. They only need to think, more likely than not, this was due to the work. They need to be 50% certain that this was, or 51% really, that this was due to the work, right? So they don't have to sort of say, they got COVID. Well, maybe they got it because they went to a bar on Friday night. But I also know that this patient is a farm worker living in communal housing, and I know that several workers in their housing arrangements also had COVID, right? So more likely it was due to their work. Now, if you do one more click there, Sylvia. Keep going. One more. There you go. So these are some words for clinicians to use in the chart. So more likely than not, this illness or injury was due to the work. Work most likely caused the condition, but for the work, the condition would not exist. Those are our three phrases that become really critical, because should the patient, whether at the moment it's a minor injury or seems to be a minor illness, in the long run, it gets to be bigger. These words become really, really important. And if, of course, if it's a major injury or a major illness at the moment, these words become very important as well. But the key thing is more than 50% likely due to the work, and that can help a patient in so many ways when they are dealing with an injury down the line, or dealing with an injury at that moment and needing to access workers' compensation. Next slide. So again, that chart documentation is critical. Documenting that it was work-related is critical. And also engaging with legal help at this point might be really helpful, because sometimes the clinician is not going to be able to sort of have the time to help walk the patient through some of the legal aspects of this that might be helpful to the patient. And so sometimes these medical legal partnerships could be really helpful, or working with a lawyer in the health center just to help the patient sort of navigate this system should they choose to do workers' compensation. Next slide, please. And then what can the community health worker do? I talked about what the clinician can do, but I think learning about farm worker health and safety resources in your community, I just mentioned like this medical legal partnership. Is there a legal aid nearby? What are the resources in your community that when you're dealing with a worker injury would be helpful, in addition to the healthcare provider that you're dealing with? And is there ways to help educate patients, and who are there groups that do worker education? Just learning more about what resources are in your community. And then talking to the workers about their rights and workers' compensation. And you may have a worker that is kind of on the fence about whether or not they should, deal with some of the challenges that would be involved with accessing workers' compensation. And they may choose not to, but at least they have a right to know what their rights are and what they would gain and what some of the challenges might be in accessing workers' compensation. And then if you're dealing with your farm worker patients and you're doing outreach in the community, really talking to the farm worker patient about making sure that the clinician that's caring for them understands that this work injury happened at work, or it happened as a result of them living in farm worker housing, and helping them understand that they can remind the clinician who's caring for them that is really important for them to know. Next slide. So I'm going to just talk to you a little. First of all, before I go on, is there any questions about workers' compensation? We had a question, I think I answered about workers' comp, but if you have any about being without authorization to work here, if you have any questions, feel free to put them in the chat, and we can try to get you some answers. But I think I've mentioned that workers' compensation can be a little bit daunting, or the farm worker isn't going to want to access it. But the farm worker, regardless of his or her decision to access workers' comp, may still need ongoing medical care. And one of the challenges could be, how do we make sure that the patient or the farm worker is getting continuity of care as they're dealing with their illness or injury? Because we know they're here on an H-2A visa, right? And they're going to go back to their home country at some point in the year. And if they're dealing with a work-related illness or injury, regardless of workers' compensation, we need to make sure that they have continuity of care. So I wanted to tell you a little bit about MCN's Health Network program. And I'm wondering if you can put in the chat if any of you have heard about MCN's Health Network program, or if any of you have used it at all. So just like a yes or no in the chat, and let me know if you use it at all. And Xavier, we'll get to your question in a little bit about the filing. Right, so I'm getting some yeses, some have heard about it, some no's. Anyone else want to put in the chat whether or not they've heard of the Health Network? Okay, so Health Network is really, I know I'm from MCN, but it's really a great program for any patient, or including our farm worker patients that might be on the move. And particularly when we're talking about our H-2A workers, we know that they are not going to be, more likely than not, they're not going to be in this location for a full 12 months. They're here on temporary visas. So what happens if they need some help coordinating their care, getting medical care? What happens if they've started to see a doctor or a nurse at the local community health center and they go back to Mexico? So I'll go to the next slide, please. So Health Network is what we call bridge case management, or helps with continuity of care. And it's free to the worker and it's free to the health center. But essentially, what it does is the patient gets enrolled, and there's two simple forms that an outreach worker at the health center can fill out. One is basically a contact information form, and the other is, a form that says, that deals with the HIPAA or the Privacy Act. So there's two forms that are filled out, and that can be done on the phone with MCN. It can be done with the outreach worker. And once the patient is enrolled, the healthcare provider can send the records to MCN and let the healthcare, let MCN know that this is the diagnosis, this is the treatment plan, whatever the record, whatever the health records say. And then if that worker goes back to Mexico and or wherever that worker is from and needs care, and MCN can help make sure that the worker is finding a provider in Mexico and make sure that those records, any diagnostic tests that have been done and any type of medicine that's been prescribed, all that information is sent back to the clinician in the place where the worker is from. And vice versa. Let's say a worker is coming into the US and has been, being treated for something, but they can still work, but they need to check in with a healthcare provider while they're working. They can get enrolled in an MCN's health network. And again, that care can get coordinated and make sure that appointments are getting set up and that the worker has a continuous medical home while he or she is in the US. And so whether they're in the US and they're going back to their sending country, or they're in their country of origin and they're coming into the US, Health Network can really help with that continuity of care. And we've done a really great job with a lot of women who are pregnant, not just for H-2A workers, a lot of people with dealing with tuberculosis because there's such a long treatment of tuberculosis. And so this is a case management system. Everyone's bilingual. And when they don't speak that language, they're very good at working with an appropriate language line, and it's helped a lot of patients. So I wanted to make sure everyone here can walk away from MCN or this webinar knowing that MCN has a program, and it's on our website. And on our slide later on, there's a link to the MCN website where you can find out more information and where you can go to register patients in this particular system. Next slide. I also wanted to let you know that there's a lot of resources both on the Farmworker Justice site and on MCN site, but I put this in here with our specific link in that we have some really great comic books about workers' compensation and describing to the worker what is workers' compensation, why do you do it, how do you talk to your doctor about it. And we made these for some of our dairy projects, and we have them for several different states depending on what the workers' compensation regulations are in that state. So if you're in Wisconsin, it's one way. If you're in New Mexico, it's another way. But that's only like one little blurb, one little page of it. And so I think regardless of what state you're in, this could be a really good resource. And we've worked with lots of different groups to change it so that it's applicable to the state that they're working in. It makes sense. So we have about 5 or 6 different states on our website based on groups coming to us and saying, hey, can you change this to make it relevant to New Mexico? But it's like one page in there that deals with that. And then I think the rest you'd find very helpful. Next slide. And then I welcome all of you to connect with MCN on Facebook, on LinkedIn, on Twitter, but also we have so many resources for you at our website, and you're welcome to explore our website and find out more resources. We have lots of different comic books for you on pesticides, on diabetes, on COVID. Please explore. They're in English and Spanish, and it's all yours at no cost. And with that, I think Alexis wants to talk just a little bit about FJ, and we'll then return to some of the questions that got answered or got asked.
Thank you, Amy. And that was such great information, really important information, not only about workers' compensation and questions clinicians should ask, and documentation, but also the role of community health workers and the health network. So thank you so much for sharing all of that. I do want to share actually, and it's not up here, but we have on our website, we have an interactive map. And so when I showed about workers' compensation, I showed that map of the United States. That map is available on our website. You can go to your state and you can see what the laws are regarding workers' compensation, regarding wages, and also overtime. It is in English, but we do encourage you to go to that link. We also have a lot of resources, not just in English. We, just like MCN, we have created resources for farm workers, for community health workers, and for advocates. We have fact sheets. We have fact sheets on the Affordable Care Act. Many of our resources for workers are in multiple languages. Most of our resources are, at least for workers, are at least in English, Spanish, and Haitian Creole. And then a number of our resources are also in Indigenous languages, including Mam, Mixteco, Triqui, and Quiche, depending on the resource. And we use comic books, but we also use videos, as well as fotonovelas. You see here on the bottom of the page, there's a still. We created an educational video on the Affordable Care Act called El Triunfo del Amor y la Salud. And it is a telenovela style video about the Affordable Care Act and about the importance of having health insurance coverage. It focuses on a family. We worked with, and it includes an H-2A worker who is in Washington State. We worked with Quincy Community Health Center and Farmworker community members to create the video. So all of the actors are actually workers and other members of the community in Quincy. It is available in Spanish, Spanish with English subtitles, and then English narration and Spanish with English subtitles. So we have three different options, and that video is linked here. It's about 15 minutes. I would show a part of the video, but then I'll have to show the whole video because it's so good. So I will encourage you to just go to the video and check it out yourself. It's a very telenovela. It's really entertaining, but also educational. But then in addition to that, we have materials about health centers. We have materials about a lot of different issues, but then we also, talking about workers' compensation, we worked with Migrant Clinicians Network to put together a guide for clinicians on workers' compensation. And Amy, I think we can use that to respond to Javier's question about workers' compensation. So we'll come back to that. But this is all available on our website. So I encourage you to go to our website. And then I think that is it in terms of the presentation. Do you want to go to the next slide, please? So with that, I think we should stop here, Amy, and respond to any questions. Maybe go back to a few of the questions that we received during your presentation. And then I see that Julia put in a question as well.
Great, thanks, Alexis. Thanks, everyone. So